Very good. Hey, it's so great to get emails from our viewers across the country. We're at 125 million TV homes every weeknight. Of course, we're also simulcast on American Forces Network in 175 countries and all the ships at sea. And of course, simulcast on radio in a number of places. But thanks to BizTV, thanks to Bloomberg, thanks to American Forces Network. But we got, if I'm not mistaken, Greg, our executive producer, we got an email. Was this from a shareholder?
I believe so.
And it was a shareholder of a company called Clearmind Medicine. They are publicly traded under the stock symbol CMND. And of course, Adi Zuloff-Shani is the CEO of the company, and she is she in Israel right now?
I believe so.
Well, these guys are treating addiction. Mike, I want you to listen up on this one.
Ears cocked.
I don't think it's food addiction. Dr. Zuloff-Shani, thanks so much for putting up with us during the beginning of this, and great to see you here. And I know that's probably 3 a.m. Next Monday in Israel, but happy Thursday to you here in the U.S. Great to see you.
Thank you.
Hey, can you give us an overview? You guys are a psychedelic pharmaceutical company, which I dabbled in the 60s, but I had my own private business. No, but this is serious stuff. You guys are focused on discovery and development of kind of psychedelic derived therapies, if I'm not mistaken. Talk about what you guys are treating and why this is so front and center now.
Correct. So we're a pharmaceutical company with our active pharmaceutical ingredient being psychedelic derived. We are currently developing treatments for various addictions. First addictions is alcohol use disorder. We are just about to start our first clinical trials in humans, but we're also developing something psychedelic based for weight loss.
Wow.
And yeah.
Me and Mike are looking at the chart here and asking for a friend. We're like 5 of the 6 up there. Mental health, depression,
we need to
obesity.
Be your study group.
Yeah, the thing for eating disorders, they're sure fun. Hey, but seriously though, we've been on the show now for close to 30 years on radio, close to 12 years on television. We've interviewed everyone in terms of biotech, biopharma, all the way through every industry. And recently, we're just hearing about the psychedelics thing. And of course, I jest when I talk about the 60s. Because it was mind-altering, it was Timothy Lear and so on and so forth. But we're talking about these drugs in terms of suicidal ideation sometimes, as you say, in dealing with addictions. When did this sort of hit the tip of the spear? Because it seems like it's all new to us out here as consumers and as patients. Is this something that's recently new, or have you been working on it for a while now, suddenly it's coming to the peak?
That's a good question, because it was already discovered and there were clinical trials conducted with various psychedelics already at the beginning of last century, but for many reasons, and I don't want to go into the reasons, they were abandoned, they were stopped. But now, because there is such a rise in mental health disorders, and there's really nothing good out there to offer patients who suffer from that, and we know that anxiety, PTSD, depression is something that is continuously on the rise. There started to be an openness from regulators, from physicians, from pharmaceutical companies, understanding that psychedelics bears a huge potential. And there's a lot of investigations going around psychedelics. There are literally articles coming out of the best universities showing the potential. And we're at Clearmind, we also noticed this, but I think that what differs us from other companies in the space, universities, whoever is doing studies and studying psychedelic, is that our compounds are unique, innovative, and we have patents that protect, which is huge for investors.
So, doctor, I have a question, because I know that historically treatment for alcohol disorder or drug disorders is typically abstinence totally, you don't try anything that's mind-altering substances.
And that's ridiculous, for God's sakes, I just want to say.
But I do know that microdosing and this type of treatment, psychedelics, is coming into treatment for this type of thing. And I hear the term microdosing under the care of a doctor. This is something similar to what you're doing, correct?
So no, our drug is slightly different. It is psychoactive in terms that it gives you a sensation, by the way, of like you had small portion of alcohol, even if you didn't have any alcohol whatsoever. But mainly what it does, it's like switching on a switch telling you that you are satiated. You don't need anything. You're good. You don't want to drink. This is based on testimonials that we heard about our product, MEI. The more well-known psychedelics that we hear a lot about. They are adjunct to psychotherapy. They are hallucinogenic. You need to be guided through the experience. MEI is not a hallucinogenic drug, so you're not going to go into trips. You don't need anyone to guide you while you're taking it. You can take it in the privacy of your own home. So it's slightly different. It is comes with all the benefits that we hear about psychedelics, that they're really doing something. There are great results and people are enjoying psychedelics.
Dr. Adi Zuloff-Shani is the CEO of Clearmind Medicine, stock symbol CMND. Check him out, clearmindmedicine.com. Doctor, my body is a temple. I don't put anything bad into it.
It's an enormous temple.
It's an enormous temple.
Much like the pyramids of Giza.
Yes.
In fact, you're kind of shaped like that.
The Taj Mahal of human beings. But are we talking, are these chemical compounds? Are they natural compounds? What is the makeup of the psychedelic?
So ours is chemical. And I have to say that as a CEO of a pharmaceutical company, I always prefer synthetics because you know that it's constant. You always get the same dose. You always take the same formulation. It doesn't change, but essentially it's the same because essentially it's like a dance, if you will, between the receptor and the molecule. And it doesn't really matter what is the origin of the molecule. And I'm sorry, but I didn't relate to the question that the lady asked me about addiction. We are a pharmaceutical company, meaning that we are taking baby steps when we develop something for humans. And the major thing that we are pursuing is safety. And for sure, we will not want to switch one addiction with another. So we do studies to understand if MEI, our compound, is addictive. And I can tell you that the studies that we have been conducting until now, we haven't found MEI to be addictive any whatsoever. It's not rewarding. We even compared it to sucrose and cocaine, highly addictive components, and we didn't found it to be rewarding in comparison.
I've got to say, she belongs to the whole show club.
Yeah, she's an hour.
Dr. Adi Zuloff-Shani, will you come back with us and spend like the entire hour? I mean, it's one of these, I mean, it's such an interesting topic. We want to have you come back. By the way, they are publicly traded under the stock symbol CMND. It's Clearmind Medicine. Clearmind Medicine is clearmindmedicine.com. Their stock symbol CMND. Thank you, man. I just, asking for a friend, but